The debate is officially on. It's a question that comes up quite often. Which job is better, a nurse or a respiratory therapist? In this video, we're going to take a look at the pros and cons of each profession. Are you a student who is looking to enter the medical field but can't decide? Or maybe you're already a nurse or respiratory therapist looking to make a switch to a new field. Either way, the goal of this video is to educate you on the good, the bad, and the ugly of both nursing and respiratory therapy. We're going to talk about the pros and cons of each so that hopefully you can make the best decision for you. So if you're ready, let's get into it. Before we get into all the details, I feel like I need to drop this little disclaimer here. First and foremost, you should know that nursing and respiratory therapy are both amazing careers. Respiratory therapists and nurses are both vital members of the healthcare team, and you really can't go wrong when choosing between the two. With that said, this is a respiratory therapy channel, and I am a registered respiratory therapist, so naturally, I am somewhat biased towards the field of respiratory therapy. However, I do appreciate the nurses I've worked with, and nursing absolutely is an amazing field. Now, I try to be as unbiased as possible when making this video, but I want to be fully transparent. This video contains my views and perspective from working as a respiratory therapist, so this is just something to consider and keep in mind as you watch this video. So now let's get into the details. First and foremost, what is the difference between a nurse and a respiratory therapist? There are several differences because they are two totally different fields of study and practice. The main similarity is the fact that both are respected professions that emphasize providing the best care possible for their patients. In general, nurses do have a broader scope of practice. They must consider the whole patient and thus multiple body systems. Respiratory therapists, on the other hand, concentrate on the cardiopulmonary system. This means that they focus specifically on the patients with conditions of the heart and lungs. Nurses are provided with a general education of the entire human body. Respiratory therapists are provided with a more detailed education of the cardiopulmonary system. What tasks do respiratory therapists and nurses perform? In the field of nursing and respiratory therapy, they both have job duties that are independent of one another. With that said, there are also many tasks that overlap as well. In this part of the video, I'm just going to talk about some of the tasks that both nurses and respiratory therapists are involved with. This way, you can get an idea of the role that each one plays. Keep in mind that these are just a few common examples. Many hospitals have different requirements for their nurses and RTs. This is just a generalization. So first we'll talk about patient assessment. Nurses are responsible for the entire body. Respiratory therapists primarily focus on the patient's breathing. Next is general patient care. Nurses are required to help with the activities of daily living such as bathing, changing, cleaning, etc. Respiratory therapists are required to perform oral care and tracheostomy care when an artificial airway is in place. Now, this next one may seem like a silly comparison, but it is at least worth mentioning. Nurses, to some extent, are required to care for certain activities that occur below the waist. Okay, I'll say it. They have to clean up poop and pee if a patient has an accident. Respiratory therapists, on the other hand, are required to care for activities above the waist. They are required to do a lot of suctioning to get rid of mucus and secretions. Now, both of these definitely can be gross at times, but it is what it is. You do kind of get used to it over time. But when deciding between nursing and respiratory therapist, you at least have to consider which one grosses you out the most. Next, we'll talk about administering medications. Nurses can administer a wide range of medications and routes depending on a variety of patient illnesses. Respiratory therapists, on the other hand, mostly just administer cardiopulmonary medications usually via nebulization. So nurses are definitely able to administer a wider array of medications when compared to respiratory therapists. And when it comes to patient diagnosis, both nurses and respiratory therapists help to develop a diagnosis, formulate a plan of care, and implement the needed interventions. They both also communicate directly with physicians concerning the patient's needs. Next, we'll talk about discharge planning. Nurses are always involved when a patient is discharged. Respiratory therapists are only involved when the patient needs oxygen or other types of respiratory therapy at home. Next, we can talk about mechanical ventilation. Nurses are not trained to manage mechanical ventilators, BiPAP, CPAPs, or other forms of ventilatory support. They are, however, usually provided with a general education of mechanical ventilation, but typically they must call the respiratory therapist for assistance when an issue arises. Respiratory therapists, on the other hand, are fully trained to operate mechanical ventilators, BiPAPs, and CPAP devices. This includes initiation, management, and weaning from ventilatory support. Now we can talk about needle sticks. Nurses are licensed and trained to stick veins. They can initiate IV therapy for fluid management and medication deliverance. They are also trained to give shots as well. Nurses are typically not trained to stick arteries. Respiratory therapists, on the other hand, are licensed and trained to stick arteries. They can draw a sample of arterial blood to assess a patient's oxygenation and ventilation status. Respiratory therapists are typically not trained to stick veins. So that is the primary difference. Nurses can stick veins where respiratory therapists can't, and respiratory therapists can stick arteries where nurses typically can't. So next we'll talk about the electrocardiogram, or EKG. Both nurses and respiratory therapists are trained to perform electrocardiograms on all types of patients. And again, both nurses and respiratory therapists perform many other types of tasks that were not mentioned here. These are just a few common ones that overlap in both fields. So hopefully this gives you an idea of maybe which one you would prefer. How do nurses and respiratory therapists work together? RNs and RTs work together in many different ways when caring for patients. I could list out every single task, but that would make this video way too long. Instead, I just want to focus on how they can use their educational background to help one another. While a respiratory therapist may not be in charge of body systems outside of the heart and lungs, they still must use observational and assessment skills to notice when a problem arises. For example, a respiratory therapist is not directly responsible for managing a patient's fluid levels. That is the responsibility of the nurse. With that said, the respiratory therapist may notice that the patient has wet lung sounds and jugular venous distension, which indicates that they are receiving too many fluids. In this case, they could recommend that the nurse consider administering a diuretic medication. And the same thing applies for nurses as well. Nurses can make certain recommendations if they notice that a patient has developed an issue with breathing. Again, this is just a simple example of how nurses and respiratory therapists can work together and help one another out. So moving right along, what are the requirements for respiratory therapy and nursing school? Both professions in general require at least a 1 or 2 year degree in order to practice. For both careers, after graduating from an accredited program, you must pass the licensure board exams in order to obtain the appropriate credentials, which allows you to apply for a license to practice in your state. Many people don't realize that both educational programs are very similarly ranked. To give a simple example, just look at their names. You have a registered nurse, or RN, and you have a registered respiratory therapist, or RRT. Both careers provide the professional with respectable credentials, although nursing is far more widely known by the general public when compared to respiratory therapy. So first, let's talk about the nursing educational requirements. A nurse can start out as an LVN or LPN. An LVN is a licensed vocational nurse. These nurses usually did not attend a traditional brick-and-mortar school for nursing and may have tested to get their license through a reciprocity. This means that they worked in another health field and had enough school credits to challenge the LVN NCLEX exam. Most states do not allow nurses who receive their LVN this way to practice outside of that state. For example, New York and California are two states that have these types of nurses, and they cannot practice outside of the state without having to jump through a lot of hoops. An LPN, or licensed practical nurse, is a trained nurse who must go through a program that typically lasts 1 to 2 years. The length depends on how much of the prerequisites were done before entering school. And more commonly known, the field of nursing also has registered nurses, or RNs. They are required to attend and pass a traditional program that provides 2 to 4 years of education. After passing the program, the nurse then becomes eligible to sit for the NCLEX RN exam. Registered nurses have a much broader range of practice than their LVN or LPN counterparts. Now let's talk about the respiratory therapy educational requirements. A respiratory therapist usually attends school for 2 to 4 years as well. After graduated from a COARC accredited program, they become eligible to take the licensure board exams. There are 2 exams to pass in order to obtain the RRT credential. First, there is the Therapist Multiple Choice, or more commonly known as the TMC exam. And they also must pass the Clinical Simulations exam, or CSE. First, the TMC exam offers 2 passing scores, a low-cut score and a high-cut score. In order to become eligible to take the CSE, you must first pass the TMC with the high-cut score. Then if you make a passing score on the clinical sims, you will have earned the RRT credential. It is still possible to practice as a CRT in the United States, but with that said, each and every year, more states are requiring applicants to have earned the RRT credential. Another question that I often see is, which school program is harder? When talking about the difficulty of nursing and respiratory therapy school, it's really hard to quantify because there are a lot of variables at play. Either program could be more difficult for some than for others. Not to mention, some schools simply have more strict requirements than others. Taking that into consideration, it's reasonable to say that both programs are fairly difficult. Neither one would be classified as easy. But in all likelihood, the difficulty of each program is probably about the same. Both careers have general education requirements such as English, electives, A&P, biology, and chemistry. Also, both programs require clinical rotations with certified instructors as well. Most importantly, as I mentioned, both careers require passing the licensure board exams in order to practice in all 50 states. Generally speaking, both programs are equally difficult in their own way, but through my experience, I've noticed that nursing school seems to be harder than respiratory therapy school. Unfortunately, I do not have any evidence or raw data to back this up. Just from speaking with medical professionals who have gone through both programs, most claim that nursing school was much harder for them when compared to the respiratory therapy program. Again, this is definitely not always the case. It really depends on your location and the program that you're interested in. This is just a generalization that I've noticed over the years. Nurses are responsible for knowing and learning a broader scope of the entire body. Respiratory therapists are generally focused on the heart and lungs. Therefore, nurses tend to learn a little about a lot, whereas respiratory therapists tend to learn a lot about a little. So this is definitely something to consider if you're trying to decide between becoming a nurse or a respiratory therapist. But of course, just do your own research to decide which program would be a better fit for you. So now I need to briefly mention what is the cost of nursing and respiratory therapy school. Which one is more expensive? Now, according to my research, the average cost of tuition for both programs is about the same ranging from 4,000 to upwards of 12,000 per year. Now again, there are a lot of variables at play for this one as well, and it really depends on your state and the school that you want to attend. The cost of tuition can be much more expensive if you were to attend a university, whereas it could be much less expensive if you enroll in an accredited program from a community college. For example, the BSN option, which is the bachelor's degree option for nurses, is obtained from a 4-year university and is often much more expensive than a 2-year associate's degree program. With that said, it's important to keep in mind that the bachelor's degree in nursing does offer more advancement opportunities, which likely explains why the tuition cost is much more. So if you plan to further your education down the road, it's definitely worth considering paying more for tuition now in order to earn a higher salary in the future. However, if you know that you only want to practice as a registered respiratory therapist or just as a registered nurse, then the 2-year programs that are offered by community college are just fine, and they are a great way to keep cost as low as possible. What is the job outlook for respiratory therapists and nurses? Respiratory therapy is a newer field compared to nursing, which is why it's not as widely known. With that said, both fields are rapidly growing and gaining more recognition each year. As the baby boomer generation continues to age, even more nurses and respiratory therapists will be needed to keep up with the demand of new patients. Therefore, it's safe to say that the job outlook is great for both careers. According to the Bureau of Labor Statistics, both nursing and respiratory therapy are expected to grow at much faster rates than the average profession. Throughout the year of 2028, a respiratory therapist job outlook is expected to have a 21% growth, and the job outlook for a nurse through 2028 is expected to have a 12% growth. Both fields are rapidly growing, but respiratory therapy seems to be growing at a faster rate than nursing, and this is likely due to an increase in the prevalence of COPD and smoking-related conditions. And now the question you've all been waiting for. Who earns a higher salary? Does a respiratory therapist make more than a nurse, or do nurses earn a higher salary? Now, to answer these questions, it really just depends on the state and institution where you want to work. Generally speaking, both nurses and respiratory therapists do quite well when it comes to salary. And guys, just know that it's not all about the money. It's really not. You shouldn't choose a career just on salary alone. Doing something every single day, day in and day out, that makes you miserable just because it pays well just is not worth it. But with that said, in today's society, even though you really can't buy happiness, money is definitely a requirement in order to purchase food, water, shelter, transportation, and everything else we need to survive. So while salary isn't everything, it definitely is something that you should consider depending on your lifestyle and goals. According to the Bureau of Labor Statistics, the average salary for a nurse is around $73,000 per year. The average salary for a respiratory therapist is around $61,000 per year. So on average, nurses tend to earn a higher salary than respiratory therapists. But again, it's very dependent on your location, among many other factors. Some states simply just pay more than others. But thankfully though, respiratory therapists and nurses both earn very respectable salaries, although on average, nurses typically earn slightly more than respiratory therapists. And now you may be wondering, which job is more stressful? Both professions deal with sick people in critical situations. This means that naturally both professions have their moments of high stress situations. Responding to a code blue is an example. This usually means that a patient has stopped breathing or doesn't have a pulse. The entire medical team is involved in performing CPR, but the respiratory therapist will most likely be the one responsible for securing the breathing tube into the airway. This process is known as intubation and can be very tense and stressful and requires the ability to keep cool under pressure. Now, normally, the nurse is not the one running the code. That is the job of the physician. And in these cases, nurses are responsible for taking notes, assisting with compressions, and administering proper medications. And once the patient is intubated and stabilized, the respiratory therapist is also responsible for setting up the patient on the mechanical ventilator for life support as well. Now, this is not to say that being a nurse isn't stressful. Working as a nurse can definitely be stressful in its own way. For example, there's a common joke in the healthcare industry that nurses take all the blame for everything. Nurses are the one who have the most direct communication with patients and their family members. And unfortunately, this means that they often take the blame for things outside of their control, such as long ER wait times, clerical errors, etc. Dealing with patients and their family members and trying to meet all of their needs definitely can be stressful, especially if you're the one who takes the blame for things outside of your control. Which job is more exciting? There are many variables that come into play in regards to on-the-job excitement. It really all comes down to your individual facility and the area of which you work. Obviously, an emergency room respiratory therapist is likely going to have a more exciting job than a nurse who works in a clinic, and vice versa if the roles were reversed. The level of action and excitement just depends on the area where you work. One benefit of working in the medical field for an adrenaline junkie is that nurses and respiratory therapists are able to work on flight teams after a few years of critical care experience. This entails flying in a medical helicopter to treat patients in emergency situations. Becoming part of a flight team requires a significant amount of extra training, and it's a very competitive field to get into, but it definitely is a nice option for both nurses and respiratory therapists to consider. So in terms of what job is more exciting, I would say that they are about equal. Both professions can have exciting days and not so exciting days. It all just depends on your assignment, where you work, and what is happening at that particular moment. Because as you know, if you work in the medical field, things can always change in a hurry. What are the career advancement opportunities for nurses and respiratory therapists? Both careers offer advancement options, but in general, there seem to be more opportunities for nurses than for respiratory therapists. First, we'll talk about the career advancement opportunities for nurses. Nurses can earn a bachelor's degree to work in hospital administration and management. They can also advance their education with a master's degree to become a family nurse practitioner. This allows them to practice under the supervision of a physician or even alone in some states. There are even more advancement opportunities for nurses, such as nurse anesthetists, pediatric and neonatal specialists, nurse midwives, and educators. There is even a doctorate of nursing practice that can be pursued. The opportunities are widely abundant for nurses. Now let's talk about some of the career advancement opportunities for respiratory therapists. Now, respiratory therapy is a relatively new field compared to nursing, which explains why there aren't quite as many advancement opportunities. A respiratory therapist can earn their CRT and RRT credential in respiratory care. They can also earn a bachelor's degree, which can provide the ability to work in hospital administration and management. In fact, more bachelor's degree programs for respiratory therapy have been opening over recent years. A bachelor's degree is also likely going to be a requirement in order to become a respiratory therapy educator as well. Another advancement opportunity that is common for respiratory therapists is to obtain a master's degree to become a physician's assistant. This path is similar to a nurse practitioner for nurses. Or, if you see yourself as the entrepreneurial type, a respiratory therapist can start a home care company. These types of companies supply equipment, clinical services, respiratory diagnostic services, and patient education on various medications and therapies. And lastly, a respiratory therapist can gain the following specialty credentials through the NBRC. They can get the Adult Critical Care Specialist, Neonatal Pediatric Specialist, Sleep Disorder Specialist, or the Registered Pulmonary Function Technologist. Each of these credentials allow for specialization and advancement in certain areas of the field of respiratory care. Not to mention, certain credentials may be a requirement for some positions. So just to recap, while advancement opportunities are growing for respiratory therapists, the field of nursing has many more opportunities at this time. So that is definitely something to consider if you want to further your career in the future. So there you have it. Well, what's the final verdict? Which career field is better? Is respiratory therapy better than nursing, or should you just stick with becoming a nurse? Again, that all depends on you. It's up to you to weigh all the pros and cons in order to decide which field is a better fit for your lifestyle and personality. I've given my opinion that was crafted from my experiences working as a respiratory therapist, and I hope that it has been helpful for you. But with that said, it's important to do your own research and take everything into consideration before making a decision. Just to share my opinion, I'm so glad that I chose respiratory therapy over nursing because it's a better fit for my lifestyle and for my individual personality. Now, of course, I realize this is not the case for most people, but respiratory therapy was just a better fit for me. Now, you have to weigh all the pros and cons in order to decide which one would be better for you. But whatever you decide, just know that both are amazing and respectable fields. You really can't go wrong when choosing between a career as a nurse or as a respiratory therapist. But like any profession, they both have their positives and their negatives. There will be really good days and really bad days. That's just how it is. But just know that by becoming a nurse or a respiratory therapist, ultimately you will gain a well-paying and a respectable career that provides an incredible amount of fulfillment. You'll get to wake up each day knowing that you're making a difference in the lives of others. And I mean, what more could you ask for? If you thought this video was helpful, I'd greatly appreciate it if you hit that like button so that this video can reach and help more people. Also, be sure to subscribe for more videos about respiratory therapy, nursing, and the medical field in general. Now, what are your thoughts? I want to know which one you prefer. Do you prefer nursing or do you prefer respiratory therapy? Please let me know down in the comment section below so that we can keep the discussion going. That's it for this one. Thank you so much for watching, and I will see you in the next video. And as always, breathe easy, my friend.